Good morning. If you have decided to study to become a professional hypnotherapist, keep watching our training videos about hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And in addition, you will be able to download several ebooks also free. Let's see the basic principles of regressive therapy. Basic principle of the therapy. The baby arrives with a brain ready to store data in it. But as the left hemisphere is not yet developed, it does not have the capacity to analyze and judge why things happen. Depending on how he has lived the first stages of his life, he will have one personality or another. If these first stages are lived without any shocks, with love and tenderness, it will create a strong and secure personality. The origins of the majority of psychological disorders are emotions retained or blocked in infancy or even before. Since the baby does not know why things happen, they simply hurt. For example, a baby a few months old hears the loud noise of a firecracker. Not having developed his left hemisphere, cannot reason the sense of that loud noise. He has only heard a loud noise and has been frightened. That emotion has been blocked and the baby has retained erroneous information. Firecracker child, the same fear adult, the same noise phobia. The therapy will consist of returning the adult to the time when he or she was a baby and heard the loud noise. He has to relive the situation he experienced as a baby, now with the mind of an adult. By reliving the situation again, but with the adult mind, the patient has the ability to change and correct the erroneous information received as a baby, reliving and realizing the experience. Firecracker the same, to party and have a good time. The therapy is based on returning to the patient under hypnosis and looking for where the emotional impact took place. Once the patient has returned, he or she has to relieve the impact. The advantage is that the patient, being an adult, has a developed brain. That is to say, now he or she has the mind of an adult and not the mind of a child. Therefore, the patient can now rationalize what happened to him or her, which he or she could not to do at the time, due to his or her immature brain. The patient normally uses defense mechanism to be able to move on, but this is no more than a patch, which can easily be broken when another negative experience appears. In addition, negative experiences can accumulate one after the other, bursting the patch, with serious psychological consequences for the patient. Regressive therapy is used to relabel emotional impacts. It is used when we have a patient whose disorder is derived from a blockage caused by an emotional impact experienced in a childhood. For example, dog phobia. I have been afraid of dogs since I was a child, when a dog bit me. It would be necessary to go back to the past experience where the patient was bitten and make him relive the situation with his adult mind and make him see that the intention of the dog was not to bite him, but rather that he was playing. It is necessary to close the experience correctly. The dog only wanted to play. It was a simple accident and it will not happen again. With this, the patient unblocks and associates dog to pet and not to fear. Let's talk about transference. We make a patient relive acts of his youth or childhood which led him to experience a strong emotional impact with a certain age difference, and we make him relive those circumstances of his youth or childhood with the experience and maturity that his adult patient has today. It is not the same for a person of 6 years old who can be impacted by something simple as it is for a mature person who would not be impacted by the same situation at all. To that child, that situation would provoke an emotional impact and a conditioning that would lead to a pathology, By means of the procedure of hypnotic protocol, we make a regression to the patient, and this one makes a transference to the hypnotherapist. Once we have what has been transference by the patient, we proceed to apply a counter-transference of maturation, relabeling, reanalysis, and the association of what has been transferred. The patient will respond to a new association and relabeling, and will therefore respond with a new unconditioned behavior. The aim is to close an experience. An experience is well closed when it is reanalyzed, relabeled, and reassociated, and no longer conditions. That experience, which before conditioned in a pathological way, now does not condition. For this, it must be reanalyzed, relabeled, and reassociated. The patient must understand that this experience is conditioning him or her. They must also understand that this experience, which had an emotional impact on them as a child, nowadays as a mature person should not condition them, because what they saw as a child, which was shocking, now being an adult, he sees that it was really an unimportant experience. It is not something traumatic. It was in his childhood, because he had the mind of a child. Today he has the mind of an adult, and that experience he lived, he has to see it with the mind of an adult. He has to relabel, reassociate, and reanalyze that childhood experience to see that it was stupidity. This relabeling, reassociation, and reanalysis, which is done to the patient, must not clash without his moral code. Pulling the threads. Our function is to unravel the skein of wool. Hence, our work must be methodical and patient. We must pull the threads until we reach the cause, the root of the problem, where the emotional impact originated, which is now coming to light in the form of symptoms. In order to eliminate the cause, if we cut off the branches symptoms of a tree cause, not only do we not get rid of it, but we are making it even stronger. The vast majority of traumatic episodes originate mainly in the early stages of brain development. Hence, the importance of returning to these stages in the therapeutic sessions. We must search for information from the past stored in the patient's unconscious, relieve it and relabel in order to transform it into positive experiences. We revive the origin of the unhealthy root of the patient and resolve traumatic episodes which have been forming in him or her behavior patterns, producing physical tension and increasing pathological loads, which over time have been generating this psychological imbalance which has caused the cause of his or her current problems. Once relieved, we release the negative energies that were once blocked in the patient's unconscious. We then relabel them in order to transform them into positive experiences. We help the patient to find the root of his or her problem, but we do not limit ourselves to that alone. We also relabel these negative experiences to transform them into positive ones. If we see that it is not enough to release and let those negative energies flow, which were blocked in the patient's unconscious, we relabel them and transform them into positive experiences. Under hypnosis, we look for the conflicts through the conductive threads of the emotions. Once this is done, we relieve the retained emotions by means of open actions. And with this, an understanding and acceptance is produced through the exchange of information between both cerebral hemispheres by the patient. The knots are untied with the present, and the patient becomes aware of how he or she has been able to live with the trauma for so many years. And if this is not enough, we relabel the situation, transforming it into a positive experience. With all this, the patient has a new present. 6 phases in regressive therapy. We look for conflict through the thread of emotions. We relieve in the patient the retained emotions by means of action, openness. There is an understanding and acceptance through the exchange of information between both cerebral hemispheres on the part of the patient. The knots are untied with the present, and the patient becomes aware of how he or she has been able to live with the trauma for so many years. If this is not enough, relabel the situation, transforming it into a positive experience. Search for personal well-being. The important phases. Relieving the emotional impact in order to release negative energies. Relabeling the event in order to transform it into a positive experience. Search for personal well-being. The patient, by relieving the emotional impact, can become aware of how he or she has been able to live all these years with the trauma and transform it into a positive experience. But it is not certain that this will happen. If relieving is not enough, it is necessary to relabel. With relabeling, we accelerate understanding and acceptance. In this way, we ensure positive transformation. Regressive techniques are psychotherapeutic techniques that use hypnosis to lead the person to his or her past, with the aim of locating emotional blockage and beliefs generated from painful situations and modifying them into positive structures. Regression is a tool to solve problems where other hypnotic methods have failed. If you are interested in learning more about clinical hypnosis, please watch our next video, Regressive Map. Remember, read the description of this video where you can find a link to free training classes about clinical hypnosis, and also you can download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So if you're interested, do not miss our next videos. Thank you very much.